this is Dr. David Spiro. Welcome to another episode of HUMED or Human Medicine, where we explore stories that we in healthcare have that most folks don't know about, and really exploring the human side of medicine. I'm incredibly delighted today to have Dr. Heather Hinshelwood with us. And Dr. H, welcome to the show.
Thank you, Dr. Spiro. Thank you for having me.
So if you could could you share a little bit about your background, where sort of how you became a physician and how you got to where you are today?
Yeah, 100%. So I grew up in Orlando, Florida, and like so many doctors, it's the only thing I've wanted to do for as long as I can remember. I went to high school in Orlando, Winter Park High School. I went on to study exercise physiology at the Florida State University in Tallahassee. I was there in the golden years with Bobby Bowden, and we were always playing for a national championship. From there, to my surprise, I fell in love with the College of Medicine at the University of Florida, which um, I know you're in Arkansas, David, so you have some idea how serious football is. So for me to transition from garnet and gold to blue and orange was a hard sell for me, but a reflection of how amazing I found their College of Medicine to be, and had just a phenomenal 4 years there. Fantastic training, could not have asked for better, and matched to my first choice residency at the University of Florida in Shands-Jacksonville, and did emergency medicine residency there. Now, what is kind of interesting is that 9/11 happened my first semester of medical school. And so I can remember being on the floor of my apartment in Gainesville studying, watching the towers coming down. And, that was obviously very formative. So a couple weeks later, for starters, I got my first bill for my student loans, which was incredibly uncomfortable. And then a few days after that, I got a postcard talking about a scholarship for the U.S. Navy for medical school. And I come from a military family, and 9/11 had just happened, and I said, well, let me do this. And if I join the Navy, I'll always be near the water, because being from Florida, I have to be near the water. I failed to recognize that we were fighting wars in two separate deserts. So I spent less time near the water than maybe I would have liked. But the medical school, the Navy paid for 3 years of medical school for me because of how kinetic both Afghanistan and Iraq were at the time. The Navy was not putting out enough ER doctors from their own programs, so they actually gave me a deferment to go train at a civilian program. So I graduated from Shands-Jacksonville, and after living in Florida for 29 years, my first set of orders was to Okinawa, Japan. And so I moved to the other side of the world, and for 2 years loved it. During that time, I did deploy to Afghanistan in 2009. I was in Helmand province. This was during the surge under President Obama. Things were not going well in general, and so we put more boots on the ground to try to even that back out. And so, when I was there, it was pretty kinetic. And
when you were there during that time, could you explain to us what your role was?
yeah, so I was assigned to a shock trauma platoon, and I was stationed at Camp Dwyer, which was not the largest base in Helmand province. This is the southern area of Afghanistan, but it was a pretty large base. We had a combination shock trauma platoon and forward resuscitative surgical suite, FRSS. Still, not a whole lot in the way of logistics there. Um, I lost more than 30 pounds and I mean, I wasn't outside the wire. I was just, at the base, but between the heat and not the best food supply, I lost 30 plus pounds.
And I imagine stress.
Yeah. Yeah. I tend to be a stress eater, though, so if I'd had access to food, I don't know that I would have lost that much weight. But, I came home and you could see my ribs. Uh, my God bless my stepdad, he was the first one to call out, um, in the most loving way, "Heather, you don't look good." And, it was a long deployment. And so, um, after that, I was back in Okinawa and then, got stationed in Southern California. I, um, could see the writing on the wall, we were deploying so much that even before I left Afghanistan, our specialty leader told us that if we stayed in, we could expect 2 9-month deployments, 9 months in, 9 months out. And we were so over deployed that I was working more as an attending than I was as a resident. And I was so tired at that point. Because I went straight through. I went straight through college, medical school, residency, war, just all the things. And so I ended up getting out after 3 years, got married, to my ex-husband. He was a Marine that I'd met overseas and, ended up staying in Southern California because that's where his orders were. We stayed there for a few years, loved it, had a great time. He, surprisingly got orders to the, air station in Beaufort, South Carolina. And, we came out here, to look around. I also had a job offer with a group out of Savannah and just fell in love with this place. I literally looked around and said to myself, "Well, I am never leaving because it's just so great here." And so,
And here is it a place in South Carolina?
yeah, so I live in Bluffton. And
Bluffton.
yep, my office, my practice now is on Hilton Head. Uh,
Mm.
so a lot of people know
Wow.
Hilton Head as a
Yeah.
vacation destination. The Lowcountry in general just could not be more beautiful. I have everything I could possibly want. Boating. When me and my kids want crabs, we go to our honey hole and go catch us some crabs. If I hunted, I have no problem, keeping a cooler full of venison. Um, at one point, I've owned chickens periodically. That was one thing that kind of got us through some of the food shortages during COVID is my chicken supply. Bluffton's the kind of place where I can use my golf cart to take chickens over to my friend's house and also use the same golf cart to go drive to meet the governor for a fundraiser. And I've totally done both those things. So,
Wow.
yeah, it's fun.
So, so tell me a little bit about your story. Everyone has a story to tell in medicine, and I would love to hear a little bit about what your story is and sort of the genesis of what brought you on the show.
Yep. So, I'm an emergency medicine doctor by training, but I never lost my background in exercise science and nutrition. That was always there. Um, and you go into most people go into medicine like wanting to make people better. And then I think I got kind of wrapped up in like how fun, parts of emergency medicine were, like being in the trauma center, bunch of really sick patients, resuscitating them, you know, doing a good job with that. Oh yeah, they made it to the ICU or they made it on to, whatever next level. And it was after I settled here that a couple things happened. One, I moved into a small community and I'd never lived in a small community like this before. As many people know about, Hilton Head, like it is a vacation capital, but this South Carolina is incredibly rural, very, very rural. Um, and after being in the Navy and being in Okinawa, I just was kind of done with doing emergency medicine in my own community. Too much. You go to the grocery store and maybe you see somebody you didn't give pain meds to, and that's no fun. So, I was driving out to Walterboro, South Carolina, to a fantastic hospital on I-95 there called Colleton Medical Center, and I loved it. Um, Not another hospital for 50 plus miles in any direction, and Colleton is not. a trauma center, and we would get stuff dropped to us from 95 that was just bonkers. And the other part of that is that I got to know the community and my patients. And, after being there for a couple years, we all know who the regulars are, right? And I'm just watching them, get sicker and sicker and sicker and sicker, and then watching some of them die. And that was when I realized like what I was doing in the ER was not moving the needle. It was not accomplishing the thing that I really wanted to accomplish. Because 'cause I'm not looking to, like, just get, "Okay, I see you in the ER and you survived to discharge to do what? Like, to go back to the nursing home and, like, live your years out there?" That's not why I got into medicine, and then I found myself, we have somebody who was having a heart attack or a stroke, and, I'm about to fly him out somewhere, and I'm having a come to Jesus chat with him like, "Dude, you can't keep smoking. I don't know what to tell you, like, I don't have enough pills in the world to fix the damage smoking is doing to your body. You have brought this on yourself, and you have the power to fix this. You have to do different." So I found myself doing that counseling, that lifestyle management counseling in the midst of, some really sick times in people's lives. And then on top of that, a couple other things happened. Um, The first was that on my 39th birthday, March 15th, 2018, um, I was working overnight in Walterboro, and earlier that day, I'd seen something on Fox News about a helicopter going down in Iraq, and, um, my brother-in-law was in Iraq.
Mm.
My brother-in-law
Well,
was
we're
in Iraq, and I said, "No way. No, Carl's fine. Carl's fine. He's gonna be the QRF. He's gonna be the quick reaction force to go take care of those guys. It's okay." And just before midnight, I got a text from my sister that, Carl was on that helicopter that went down.
and you were on your way to a shift?
No, I was on shift.
You were on shift.
Yeah, 12-hour shift. I found out just before midnight. And, we're single coverage at that hospital, and, most of the physicians drive in from out of the area to work there,
So you couldn't leave.
and there was nobody coming. Um, I remember screaming and running to the break room, and the staff held it down for, like, 20 or 30 minutes, but patients don't stop coming, and I the whole night, I would, be in the middle of seeing somebody and randomly start crying, and I'd have to tell them why, and, just a really sucky night. Um, Carl was an Air Force PJ. It was flight Jolly 51, and everybody on board was killed.
Well, first of all, I wanna say I'm so sorry. We I don't know if you've listened to any of our prior episodes, but we had a former Marine that I work with, that, uh, is now a nurse with us, was a medic and then became a paramedic and then became a nurse recently, and we spent some time talking about how things on the battlefield were really, really difficult for him and what it was like coming back from the war, and some of his friends did not come back,
Yeah,
and
yeah,
how hard that was.
yeah. You know, at that point, it had been almost 10 years since I was in Afghanistan, and I had some tough points, but I had managed to tamp down a lot of that and just kinda keep it buried. And in the midst of that, my marriage started falling apart. Um, Not because of that, but you know, marriage falling apart didn't help me deal with, the grief. And a real kicker was when my brother-in-law told me what the autopsy report was. And that was like throwing a match on some fresh kerosene. It just,
Mhm.
um, you know, not only was it the loss of Carl in our family, but then it brought forward all the trauma from Afghanistan. Plus, as it turns out, at that point, 2018, hold on, almost 15 years in emergency medicine, and I had never reconciled, all the trauma you see day to day in the ER. I can remember in Walterboro being pregnant, 8 months pregnant, and having a SIDS baby that we were coding, and I was about to call it. And, there was no hiding how pregnant I was, and I'm trying to, like, hide behind the charge nurse who came up to, like, hear on me crying because 'cause I'm about to oh, anyway.
Well,
So
I
I
I
was
will s
at that
just
point,
real
I was not in a position any longer to, pretend like the trauma wasn't there and just keep pushing on daily through. Um, my, um the first anniversary of Carl's death, my 40th birthday, was absolutely horrific, and I would never wish that on anybody. And by that point, I really hadn't used the VA for anything, and so I had lost my VA access, and, getting it back was super fun. Uh, Trying to get back into the system, and, there was some things at the VA that were certainly very helpful. Um, I got a fantastic psychiatrist who put me on Wellbutrin, which I really needed to be on. It was extremely helpful. It was so funny because I was like, "Dude, like, I don't" Dr. Chang, "I don't need to see you, man. Like, I know that I'm, like, your easiest person. I don't need anything, I just need a refill on my Wellbutrin. You're not, like, managing 3, 4, 5 psych drugs," and he was so kind, and he's like, "No, Heather, I'll whatever you need," like, all this stuff, and I did some therapy and that was helpful, but, then in the midst of that, on top of that, we get COVID, and COVID was the straw that broke the camel's back, and up until that point, I'd been dealing with the grief, the PTSD, and the stress of losing my marriage with a combination of weightlifting and Wellbutrin. Well, COVID was just a bridge too far, and that was, like, my like, my adrenals, like, just gave up the ghost at that point, and I put on 40 pounds. There was nothing I could do about it. My body hurt all the time. Didn't matter how much I ate, how little I ate, how much I worked out, how little I worked out, just my body was just shot. And I literally had no idea what to do with myself. And interestingly enough, some of my best friends from the military live in Fayetteville, Arkansas. And this was like the first fun thing I could do with my kids post shutdown is we flew out to visit them in Fayetteville. And the husband was an army medic and the wife is a nurse. And uh, I had never heard of GLP-1s until she told me about them. And I was so relieved because my body hurt so badly and there was nothing I could do to get the extra 40 pounds off. And I was more than maxed out on Wellbutrin and it just wasn't cutting it. And so I started on Saxenda, like the earliest GLP-1. And oh my God, within 24 hours, I felt like I could breathe again, like the weight of the world had been taken off my shoulders, like like I didn't have a vice grip around my body the whole time. And that drug just the symptoms that the Wellbutrin was not controlling really got a ton better with that medication. And the weight came back off, so I didn't hurt all the time. Well, in the middle of that, I had gotten a side gig, doing stem cell injections, at a local office here on Hilton Head. And, I and our business actually picked up significantly during COVID. It's an integrated practice, and I had the freedom to start expanding the offerings, and I started building protocols so that we could get better outcomes. And then I noticed I was getting sicker patients, the patients that are too sick to be operated on. And there's a lot of, ageism in medicine. Like, well, you're 80, what do you expect? Well, but doc, 6 months ago, I could walk my dogs around the neighborhood, and now my knee's hurting so bad I can't walk around the block. Well, you're 80, what do you want me to do about it? You know? And our community in this area, it's a retirement community. People spend their whole lives grinding it out and saving up to the point that they can retire to Hilton Head and play golf 3 times a week. That's all they wanna do. And I want that for them because golf means balance, it means community, it means exercise, it means sunshine, right? So these things that these aging patients have waited forever to be able to do, like, I want them doing that because if they're doing that, they're probably not getting urosepsis and going into the ICU and dying, right?
Well, what's interesting is our guest that we interviewed recently, Dr. Christy Gibson, we talked about the core pillars of health. So, diet, sleep, um, stress reduction, uh, exercise, and community. And I read a lot about, and I've read a lot about these pillars, and movement is so important for everyone. And what's interesting is I grew up in the era where it almost had to be extreme, or at least in my mind, and just simply getting on a golf course or walking around the block with your dog
Yeah.
is a very powerful way to heal the body, to regenerate things. And in fact, Andrew Huberman, if you know who he is, he talks a little bit about just looking in the direction of the sun can be incredibly helpful
Yeah,
for the body.
absolutely it can. You know, the time that I came up in, my mom and stepmom were doing, Jane Fonda aerobics, right?
I remember.
Yeah. When I was in college, Kate Moss was the beauty ideal. I'm 5'9". I've never been Kate Moss small a day in my life, nor will I ever be, right? And so, what comes along with those 2 beauty ideals is aversion to weightlifting.
Mm, interesting.
And I've never been petite, never been I've never been a size 0 a day in my life, right? And when my PTSD was so bad, I had no choice but to go weightlift. No choice whatsoever. I There was no way I could have regulated myself in any way, shape, or form if I had not picked up some heavy weight and started throwing it around with intention. Just no way.
Interesting.
Thankfully, I found a phenomenal community here. We have a CrossFit gym, CrossFit 843, and a phenomenal group of moms because my children were little. Like, my youngest was barely walking when I started. And so here's this other group of moms, and we're just there to do our best and feel strong and seen and heard and all the things. And to have that community at a time when I needed it so badly was just very healing for me. And so, and I got to a point where, I mean, yeah, I was on active duty with the US military. I was not in fabulous shape. I mean, there was never a day in my career that I would have failed the PRT by any stretch of the imagination, but I wasn't in fabulous shape. I did my first pull up at 39. I climbed a rope for the first time at 40. Okay. And I can still more than squat my body weight, way more than deadlift my body weight, like all these things. And so I'm building muscle. Guess what's going to keep me out of the nursing home? Muscle. Period. End of story. Here's the problem is I have these aging patients who grew up max doing a Jane Fonda workout. And I have to have this conversation with them. We've got to get you in the gym. I don't like weightlifting. I didn't ask if you liked weightlifting. I said, we have to get you in the gym. This is not a, I feel like it. I don't feel like it. Oh, that doesn't appeal to me. That's not what this is. We have to, period. End of story. And if I can't get their attention with that, the next thing they're like, yeah, I'm not going to do it. Okay, then we need to pick out your nursing home. And that kinda takes them aback, but I'm like, "I'm dead serious. I don't know what else to tell you. You are not going to be able to maintain an independent life if you cannot lift your own body weight, if you cannot get yourself off the floor when you fall, if you don't have enough of a posterior chain to keep yourself from losing balance and just going backwards. If you don't have enough on your body to do that, then we need to pick you out of nursing home because that's where this is going a lot faster than either one of us would like."
Wow.
Muscle.
Yeah, I've heard all of those stories, and I I understand. Again, I'm not an adult physician. I'm a pediatric ER physician, but one of the predictive tests of health and potentially how quickly you're going to go to a nursing home is how easily. You can correct me if I'm wrong, but how easy it is for an adult to get off the floor uh, without support. Is
Yeah.
that true?
Oh, 1000%. If they can't get themselves off the floor, it's we're just waiting for the fall to come and hopefully somebody will be sort of nearby.
Hmm.
Um,
You also talked about GLP-1 inhibitors, and which is now obviously much more commonplace. And what I've read about those medications is one of the risks of being on those meds is loss of muscle mass. Is that true?
yes, if one, they're poorly managed, and two, the patient is not weightlifting.
So can you tell the audience a little bit about what you mean by weightlifting? Like, what would be your standard program for someone coming in that has been doing Jane Fonda and wants to get back and avoid nursing home?
Well, so, for starters, it depends on the phase of life they're in, right? 'Cause I have everything from 40-year-olds to 80-year-olds coming in, okay? Uh, for 40-year-old women, a lot of that I know it sounds like a tangent, but it really isn't, but the 40 to 50-year-old women, a lot of them, it's getting them on HRT. Because if we don't put them on HRT, they're not gonna have the endurance or the focus or the desire to get in the gym and do what they need to do.
And HRT, you talk about hormone replacement therapy.
Yes, yes. Getting women on that, for starters, we're just not gonna move the needle very far unless we address that issue. Um I, honest to God, would prefer that everybody do CrossFit, even my 90-year-olds. Now that seems very aggressive to a lot of people, and, um, unfortunately, I can't convince as many people as I would like to set foot in a CrossFit gym. What I like about CrossFit is that it is an infinitely modifiable workout. Infinitely modifiable, okay? For instance, the workout today that was on the schedule was it's a partner workout, 60 wall balls, so many calories rowing, an 800-meter run, and then the same calories rowing and 60 more wall balls. What would that look like for a 75, 80-year-old who'd never been in the gym before, right? They're not gonna be doing wall balls, but if you give them a box, one of the step-up boxes, and if they're strong enough, maybe like an 8-pound med ball, and they can stand up and sit down, stand up and sit down. And maybe, even if that's too fatiguing, then just taking the med ball overhead while they're seated, do that the set number of times into, modify the calories on the row. And then instead of an 800-meter run, maybe a 300-meter fast walk and then repeat. So you really can modify those workouts for all skill sets, and by and large, when you step foot into a CrossFit gym, the coaches are trained very well, because that's the other thing. People will say, "Okay, well, I'm gonna go join Planet Fitness." What are you gonna get from that? Like the little purple thing on your keychain, right? They need to be somewhere where they're going to be appropriately coached and challenged in a safe and effective way. So the other part of that is I do get a lot of patients who are physiologically compromised. I've got a bunch of connective tissue patients in my practice, Ehlers-Danlos, things like that. Those folks, especially postmenopausal, are at extraordinarily high risk of orthopedic injuries. So those folks, I'm sending them to go weight lift with a physical therapist, because that's
Interesting.
the level of expertise we need. And I have physical therapists who are thrilled to be involved in this. They are so excited to get patients weightlifting again. There's another gym here in town. I've got a couple of sets of gyms that the personal training staff is phenomenal, and I know that they're trained to the point that they're not going to hurt my patients when I send them. So I do have a couple of specialized personal trainers that I will refer patients to get that one-on-one, like, weight training with oversight that so many people need.
What is your feeling about, um I've joined a gym in the last year. I had a meniscus issue, and I used to play squash a lot, the sport. Have you heard of squash
Mhm.
before? It's like a racket sport,
Yep.
very intense, lots of movement, and I would cross with weights, and it was I was on a good program. And then I moved to Arkansas 5 or 6 years ago, and no squash here, so I picked up pickleball,
There it is, pickleball.
and then all of a sudden my meniscus went out, and so I had to figure out what to do. And over the last year, I joined a gym that does a very interesting combination of yoga, Pilates, and weights
Okay,
under heat.
okay.
So at like 105 in a class.
Mhm.
Um, so it for me, it creates flexibility. There's some strength training. I do some other strength training in addition to that. Um, but I'm wondering what your thoughts are about yoga.
I mean, I like it, I do, because flexibility is important, right? In terms of when we're talking about safety at home, because, I mean, Dr. Spiro, what are we talking about at the end of the day? My goal is to keep people out of the hospital, right? Because if we've gotten to the point where there's no choice but to go to the ER, like, we are way behind the 8 ball. So how do I keep people out of the hospital? I keep them from falling, and flexibility is a huge part of that. And so,
Because falling could be a seminal event for someone, right? Because
yes.
they can break a hip. Again, I'm not an adult doctor, but then the hip is out, and then they lose
Hips,
mobility.
femur, head
Mhm,
head injuries, and, like, damn
mhm,
everybody's on Eliquis or Xarelto these days, right?
mhm.
No, if you have a patient who falls, not only, is there the injury that they've sustained in that fall, but they're likely going to die within the next few years. That that is hard brought on the end of their life, essentially. So fall prevention is an extremely big deal beyond just the trauma from that one fall.
So I'm assuming, again, this is the first time we've met. And by the way, you're incredible. You are inspiring to me, and you will be inspiring to our audience. And not only your service in the military, but um, all the work that you've done and knowledge that you've gained that we did not learn in medical school. My former guest, Christy Gibson, and I spoke about this, and she's from Canada, and she wrote a book called The Trauma Toolkit that I
Mhm.
cannot wait to read. She had her own experience in Nepal during an earthquake, was there supervising residents, and developed PTSD and became fascinated with trauma. So we talked a little bit about this, but you have really navigated things in a way that is courageous, and I say that because you took personal trauma or multiple episodes of personal trauma, and you turned it into a form of medicine that you can actually that's meaningful to you, and using your own words, move the needle. So I just so this is the first time we've met, but right now, just because some of our audience are young learners, they're pre-med and they're thinking about going to medical school. But let me get back to my other thought. Here's the question, one of the questions of the day. You're a physician, I'm a physician. We went to medical schools that gave us a doctorate in medicine. How much uh, in medical school, how much did you learn about nutrition and sleep and exercise in medical school? Yeah, it's a big zero for me too, and it was a big zero for Dr. Christy Gibson, who went to medical school in Canada. So I find it fascinating because as an emergency medicine physician, I don't do overnight shifts. I had to figure out and self-diagnose that I had insomnia, and I had to spend the last 5 years figuring out how I can sleep to improve my health. And since I figured out the sleep thing, it's a brand new day for David. And I learned zero about that in medical school. But getting back to my other question, at this point in your career, are you now what we call a functional or integrative medicine physician, or do you still practice emergency medicine?
I do still practice emergency medicine. I drive out to Vidalia, Georgia to work. I actually have a shift there on Saturday. I really love rural emergency medicine because ain't nobody else coming. It's you or nobody. So, um, you get some really sick patients, and it's up to you to take care of them, and I very much enjoy that. But I'm also incredibly grateful that that is not my full-time job anymore. In 2023, my, partner and I bought, the integrated health clinic that I had been working at doing stem cell injections, so it's called From Health on Hilton Head, and, it has afforded me the privilege of mostly doing wellness medicine. I guess that's what I don't know what to call it either because functional kind of has its own connotation, and really what I'm doing is like integrated health and wellness. My goal is to optimize people's health so that they can live a life free of disease and discomfort to the best of their ability.
Well, we're going to wrap it up here. I'm going to say something because I try to speak from the heart and live in integrity and authenticity. And we've never met before, and you have moved me today.
Thank you.
You are my hero, and you're the reason why I started this podcast. And because I want to bring folks like you on to inspire the younger generation, and also for the general public to really understand what we do, because I don't believe folks that are not in medicine really understand what we do. You know, it's funny because my family back in New York, I'm a nice Jewish boy from New York, which is my heritage. And, you know, all my family was like, "What are you teaching? Are you giving lectures? What are you doing?" And it's like, "No, I'm actually practicing my field and I'm teaching in the moment, you
Yeah.
know, and I'm an attending physician. Yeah, I'll give lectures once in a while, but my
I just
primary
have to
job
say
is to
that was
train."
like a quick trip back to Orlando for me is was that right there. Throwing
Yeah,
some, like, Cuban going in the background, and I'm back in Orlando.
that's right.
So,
So, yeah, you're my hero, and, I think what's most fascinating about your career and my career has changed to some degree over time. I had a period of time where I was primarily an entrepreneur, and I started some companies. I don't think there's certain people in medicine that do the same thing, for 35 years. They just sort of get into an institution and they practice emergency medicine, and they do a great job at it, and they end their career that way. And there are some of us, um who choose like alternative careers and other things to do that really move the needle for our hearts and the work that we do. And I think it's courageous that you are continuing to try to move the needle. And I am 100% on board with and believe that those core pillars we talked about, including strength training and all the things that you described, are not they're not, as needed or, a maybe, they're essential.
they're not optional. Not op
If you want to live a high quality, and both high quality and quantity of life, I think it's essential to be thinking about all those things.
Yeah, the thing is, like, you start especially being in emergency medicine after a while, when shifts are full of nursing home patients, and I'm like, "What am I doing?" Like, more antibiotics until they're back next week for the next round of urosepsis or aspiration pneumonia for grandma to go, like, be in a vegetative state in a nursing home, like,
I have in my living will, I'm never gonna be in a nursing home.
I
Like, I
know.
will never be, and I have advanced directives already written, and, take the no G-tube and, let me go, and, that's not the life, that I wanna live. So, let me quickly, there's so much to talk about, but let one quick question before we go is, do you feel like the balance of wellness medicine as you described, and now the occasional shift in emergency medicine, do you feel more balanced when you come into the ED? And because the ED is hard, I work it every day,
Yeah,
not every day, but I'm an administrator and I support folks and whatnot. But I work 8 or 9 shifts a month, and when I'm there, it's like you're on.
yeah.
And whether when you walk into a shift and I hear bad news or there's something going on with me personally, physically, mentally, emotionally, I'm
Yeah,
on.
yeah.
So I'm just curious, like you had experienced multiple traumas. How is the balance for you right now?
Well, as you know, being a business owner and an entrepreneur is not easy either, you know? We bought essentially a 30-year-old chiropractic clinic and turned it into a state-of-the-art medical practice in 2 years. That is not an easy thing to do, and I wanna be clear, most of that is owed to my business partner, Henry Chris, because, he is like, I've carried the medical load, but the medical stuff is what I've been doing for 25 years, so that's, like, second nature to me, but the heavy lift of transitioning this practice to the state-of-the-art integrative medical practice that it is has fallen to Henry, but it's still pretty stressful on my side of the house. Um, but I'm certainly getting to a better spot with balance. Um, I was in Vidalia not too long ago, and there's a shooting, and instead of it being the thing that colors the rest of the day and the next shift and the next shift and the next shift, right? Yeah, okay. That was my shift, back to my medical practice on Hilton Head. It's just it's to some extent brought back my love of emergency medicine. But the other side is too, emergency medicine is a physically demanding field. It
It
is
is. It is.
punishing on your body. I mean,
You're
that
up.
was
You're up and walking around almost the
yeah,
entire
and
time.
then,
Yeah.
God forbid, you're on with a bunch of older female nurses and you end up being the strongest person there and you've got a psych patient, like, it's a problem. And so, not having to, like, do that to my body constantly, and also about a year and a half ago, I told him I'm not doing any more night shifts because I can't think straight at this point in my life for a week after I do a night shift.
I don't think anyone should be doing it. My opinion is once you hit 50,
Yeah, yeah.
I think it's not healthy to do night
No,
shifts.
no, and I'm not well, I must have pieced out early, I'm not 50 yet, but I don't feel bad because I certainly put in my dues for
Yeah.
years, years, and years.
Yeah.
But, so being able to do that, and I've found a nice, it's hard to do. That's not an easy thing. There aren't many practices who are willing to entertain, emergency medicine physicians who said, you know what, I can't do that anymore. But I'm mostly working weekends for them. And so, I'm the doc absorbing the day or mid shifts on the weekends, and that makes people happy. So it's a pretty nice setup. Pretty happy with it.
Well, thank you for being a guest on my show.
Yeah. Thank you for having me. I really appreciate it.
And thank you for being vulnerable. Okay, so we're going to wrap it up. This is Dr. David Spiro on with HUMED. Please take a listen to us on any of the places that you watch podcasts, Spotify, Apple. We're on YouTube. Please hit subscribe when you can, and we'll be continuing to bring some amazing heroes and super great human beings. And I'm just going to say, Dr. H, I'd really like to have you back on the show at some point. I
Yeah,
think that
sure. Just let me know
you
when.
yeah, yeah. There's so much more that we could have covered. And just so you know, you made the record. This will be the longest podcast that we've ever had. So yes,
Score,
you've made the record. So I
touchdown.
try to keep it in 30 minutes, but I think the audience is gonna eat this up. And so thanks for joining.
Yeah, thank you.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.